He sat at a sushi counter in Tokyo with his girlfriend. It was their last night. The chef had 30 years of experience. He pressed each piece by hand. Bluefin tuna, salmon, yellowtail, 12 pieces total. The restaurant had a 4-year streak of perfect hygiene scores. He posted a photo to his story. Caption, "Best meal of the trip." 6 days later, he woke up at 3 a.m. in his apartment in Chicago with pain so severe he thought his appendix had ruptured. The emergency room ran blood work, a CT scan. They found nothing. They told him it was acid reflux. But acid reflux does not have a boring tooth. This is Diagnosis Glitch. Names have been changed for privacy. This story is based on true events and documented medical cases. His name is Daniel Mori, 34 years old, half Japanese, half American, born in Evanston, raised in the suburbs. His mother is from Osaka. She taught him to eat sushi before he could read. He grew up knowing the difference between chutoro and otoro, between real wasabi and horseradish paste. He didn't grow up knowing that the fish could carry passengers. He works as a structural engineer, designs load-bearing systems for high-rises. He once told his girlfriend Sara that the thing he loves about engineering is that every failure has a cause. You find the stress point, you trace the fracture, you fix it. Remember that because the medical system is about to fail around him for 40 days, and a structural engineer is going to be the one who identifies the fracture point. Sara Okafor is a pediatric nurse. She works 12-hour shifts in a neonatal ICU. She's trained to notice the things other people miss: a heart rate that ticks 2 beats too fast, a color change in an infant's nail bed that means the oxygen is dropping. She once caught a feeding intolerance that 3 residents missed because the lab values were technically normal, but the pattern was wrong. She reads patterns the way Daniel reads blueprints. Remember that too. Here's the detail that reframes everything that follows. The parasite is called Anisakis simplex, a nematode worm. Between 1 and 3 centimeters long, white, translucent, almost invisible against the pale pink flesh of a salmon fillet. It coils like a watch spring inside the muscle tissue of ocean fish. Every species used in sushi carries it. Conveyor belt chains and Michelin-starred counters alike. Japan diagnoses roughly 20,000 cases of Anisakis per year, more than every other country on Earth combined. The country with arguably the strictest food safety standards on the planet leads the world in a parasitic infection you get from eating raw fish. And the worm has a boring tooth. Not a metaphor, a physical protruding dental plate on its head designed to drill through living tissue. Daniel went to the ER 3 times in 4 days. First visit, 3 a.m, he told the attending physician the pain had started suddenly after dinner and had not stopped. Blood work showed a mildly elevated white count. No fever, no vomiting. The diagnosis? Gastroesophageal reflux disease, GERD, acid reflux. He was given antacids and told to follow up with his primary care physician. Second visit, 3 days later, same pain, worse, radiating across his entire upper abdomen. He couldn't stand upright. A different physician saw the GERD diagnosis from the first visit and agreed with it. The first diagnosis was already written down. It became the truth by inheritance. A proton pump inhibitor was added. He was sent home again. Sara drove him to the 3rd visit. She walked up to the triage nurse and spoke in her work voice. Calm, clinical, precise. His pain is epigastric and constant. It is not positional. It is not responsive to PPIs. He has not eaten in 4 days. He's lost 6 pounds. This is not reflux. The nurse wrote down acid reflux. Daniel requested an endoscopy, a camera down his throat to look at his stomach. He was told the wait time for a non-emergency gastroscopy was approximately 40 days. He said to Sara in the parking lot, 40 days? I'm going to be on antacids for 40 days for something that is not acid reflux. She asked him how he knew. Because acid reflux does not feel like something's chewing on you from the inside. He was right. Something was. The boring tooth was already through his stomach lining. For 40 days, Daniel Mori took antacids for a condition he did not have while a worm drilled deeper into his stomach wall. Week 1, he stopped going to the office. The pain made it impossible to sit upright at his desk for more than 20 minutes. He tried working from the couch, laptop balanced on a cushion, spine curled to the left because lying on his right side made the pain spike. He designed a load-bearing column for a parking structure in River North while something bore through his stomach in the same position a person uses to protect themselves from a blow. Week 2, Sara moved in. She set alarms every 3 hours to make sure he drank water. She brought home electrolyte packets from the hospital pharmacy. She kept a notebook on the counter, date, pain level, what he ate, how long he slept. She was charting him the way she charted her patients. She did not tell him that. Week 3, 22 pounds lost. He stopped answering texts. He stopped calling his mother. His mother called Sara instead. Sara told her Daniel had a stomach condition and the doctors were working on it. She did not tell her that no doctor had looked inside her son's stomach, that no doctor had asked the one question that would have changed everything. Week 4, Sara could not sleep. She sat at the kitchen table after Daniel finally passed out, which was rare and never lasted more than 90 minutes. She opened her laptop and started doing what she does at work when the numbers do not make sense. She pulled the pattern apart. Sudden onset, post-travel, epigastric, constant, not responsive to acid suppression. She typed parasite from raw fish into a search bar. Anisakis simplex. She read for 2 hours. She read about the boring tooth, about the acid-resistant shell, about the enzymes that dissolve living tissue, about the invisibility cloak, a mechanism where the worm rapidly sheds any antibodies the immune system attaches to its surface so the body's soldiers cannot grip the target. She read about a woman in Spain who ate cooked fish 5 years after an infection and nearly died. She showed Daniel what she found the next morning. He looked at the screen for a long time. Then he said, "I already thought of this, but nobody at the hospital asked." Nobody in that emergency room across 3 visits asked one question: did you eat raw fish? When the endoscopy finally happened, the gastroenterologist inserted the camera and stopped talking. Sara was in the waiting room. She later said the silence from behind the door was the worst part. The screen showed a battlefield. White, thread-like worms embedded headfirst into the mucosa, their tails whipping in the gastric fluid. Some were buried so deep that only the tail was visible. One was coiled inside a pocket of inflamed tissue that had already begun forming a granuloma, a dense of mass immune cells that had built a fortress around a worm it could not kill. Approximately a dozen living Anisakis worms actively penetrating his stomach wall at multiple sites for 40 days, while Daniel took antacids. The gastroenterologist turned to the assisting nurse and said 5 words Sara will never forget. She heard them through the door. "I have never seen this." The extraction was violent. Standard biopsy forceps cannot grip a worm that resists removal with the same boring tooth it uses to dig in. The gastroenterologist used jumbo forceps and ripped chunks of stomach lining out with the worms still embedded inside. You can't just pull the tail, it snaps. The head stays alive in the tissue and keeps drilling. You have to take the flesh with it. Each extraction site bled immediately. Dr. M. Teresa Audicana and Professor Malcolm Kennedy described what the boring tooth actually does once it anchors. The larvae use mechanical disruption of tissue combined with the release of potent proteolytic enzymes capable of degrading the extracellular matrix. It melts through tissue the way acid eats through paper, and it does this in one of the most densely packed fields of pain receptors in the human body, the stomach wall. Every fraction of a millimeter the boring tooth advances detonates a new cluster of nociceptors. Emergency physicians have documented cases where intravenous morphine failed to control the agony. Not reduced it, failed. Daniel's pain for 40 days was not inflammation. It was a drill bit grinding through a nerve field, millimeter by millimeter, while he took antacids. But within 30 minutes for the last worm being removed, the 10 out of 10 pain dropped to 0. Not reduced, gone. 40 days of agony erased in half an hour. The worms were the entire source. Daniel called Sara from the recovery bed. His voice was steady for the first time in 40 days. "They found worms in my stomach from the sushi. It is over." She did not say anything for a long time. Then, 40 days. I told that nurse it was not reflux. But the worm left something behind. Humans are a dead-end host. Anisakis cannot complete its life cycle inside a human body. The worms that were not extracted died in Daniel's tissue. When they died, they rotted. His immune system detected the decaying foreign protein and launched a siege. Eosinophils flooded the area. They built granulomas around each carcass, masses that show up on scans. Masses that look exactly like tumors. Daniel's follow-up scan showed 3 granulomas in his stomach wall, not cancer, scar tissue around dead parasites. But they will be there for years, and every future scan will require a doctor who reads the chart and understands what they are. Then, 3 months after the extraction, the boring tooth came back to finish what it started. Not the worm itself, its ghost. Daniel ate grilled salmon at a restaurant, fully cooked, no sushi, no raw fish, well above 60 degrees Celsius. Within 2 hours, his throat began to swell. His lips tingled, his blood pressure dropped. Sara called 911. Paramedics pushed epinephrine. He was stabilized in the ambulance. He did not understand. He had eaten cooked fish. His allergist ran a panel. Anisakis-specific IgE antibodies. Positive, highly elevated. The worms in Tokyo had rewired his immune system permanently. His body now recognized Anisakis proteins the way a peanut allergy recognizes peanut proteins. And the protein responsible, Anis4, is thermostable. It survives cooking. It survives canning. Dead worms and cooked fish still carry the molecule that triggers the cascade. Dr. Autacana documented this pathway in 1995, over 30 years ago. A woman in Spain ate fully cooked hake and went into cardiovascular collapse from a dead parasite she had swallowed weeks earlier in a different country. The sensitization mechanism has been understood for 3 decades. There is still no routine screening for Anisakis IgE in any Western country. No warning on menus, no advisory at airports. Daniel Mori now carries an EpiPen. He cannot eat fish, not raw, not cooked, not canned tuna, not fish sticks, not fish sauce and Thai food. A structural engineer who grew up eating sushi with his mother in Osaka can never eat sushi again. His mother still does not fully understand why. She keeps offering. Here's where Daniel's story stops being about Daniel and starts being about the system. A man in Rome, Italy, same parasite, same symptoms. The surgical team diagnosed acute bowel obstruction consistent with Crohn's disease. They performed a full emergency laparotomy, a midline incision from sternum to navel. They cut him open, resected a portion of his bowel, stitched him shut. Recovery time, weeks. Surgical scars, permanent. In the pathology lab afterward, they found a single Anisakis worm inside the wall of the intestine, 2 centimeters long. He lost a section of his bowel to a parasite that could have been removed with an endoscope and forceps in 15 minutes. Nobody asked if he ate raw fish. A 40-year-old man in Japan, routine screening endoscopy found what appeared to be early gastric cancer. Endoscopic ultrasound confirmed the depth. The team removed part of his stomach. Pathology found a small cancer, but directly beneath it, chronic Anisakis granulomas had distorted the tissue so severely that the cancer appeared to invade deeper than it actually was. The boring tooth, even after death, changed the staging. He lost part of his stomach based partly on tissue distortion caused by a parasite nobody knew was there. Dr. Mohammed Qasim Khan at the University of Chicago published the warning that should be taped to every emergency room wall in the Western world. Anisakis carries the ability to mimic common gastrointestinal diseases, including malignancy. It is imperative for clinicians to be vigilant. But clinicians are not vigilant because Western medical training treats Anisakis as a Japanese problem, something you study for the board exam and never see in practice. And that made sense in 1985 when sushi was a niche cuisine. It does not make sense now. Raw fish consumption has gone global. Imported salmon from Norway, supermarket sushi trays, poke bowl chains on every block, ceviche from Lima to Los Angeles. The parasite followed the supply chain across every ocean. The diagnostic training stayed in Tokyo. There is no pill, no anti-parasitic drug that kills Anisakis in human tissue. Albendazole does not work. Ivermectin does not work. The only cure is a camera and a pair of forceps. A gastroenterologist physically seeing the worm and pulling it out by hand. The cure requires the correct diagnosis. The correct diagnosis requires someone asking the right question, and the right question requires the doctor to believe the parasite is even possible. A CT scan cannot see a 2-centimeter worm. It only sees swelling, and that swelling looks exactly like Crohn's disease, appendicitis, bowel obstruction, or cancer. The imaging sends doctors in the wrong direction with high confidence. They're not guessing, they're diagnosing correctly based on what they can see. What they cannot see is the boring tooth. The CDC does not require Anisakis reporting in the United States. Nobody knows the real American number because nobody's counting. The FDA recommends freezing fish intended for raw consumption to minus 20 degrees Celsius for 24 hours. Recommends, not requires. There is no federal mandate. Compliance is voluntary. Japan enforces the protocol. The rest of the world suggests it and hopes for the best. Here's what I need you to understand. The glitch in this story is not the worm. The worm's doing exactly what evolution designed it to do. Daniel was an accident, collateral damage in a life cycle that has nothing to do with him. The glitch is the gap between what doctors know and what doctors ask, between what agencies recommend and what they enforce, between a parasite that infects 20,000 people a year in one country and a diagnostic framework that treats it as an exotic footnote everywhere else. A man in Chicago had worms boring through his stomach for 40 days because nobody asked if he ate raw fish. A man in Rome lost a section of his bowel because his infection looked like Crohn's on a scan. A man in Japan lost part of his stomach because dead worm tissue made his cancer look worse than it was. And a pediatric nurse sitting at a kitchen table at 2 a.m. found the answer in 20 minutes by doing the one thing 3 emergency physicians never did. She asked the right question. Daniel said something I cannot stop thinking about. He said, "I design buildings. Every load-bearing system has a failure point. If you know the failure point, you reinforce it. If you don't know it, the building comes down." The failure point in that emergency room was not a test. It was not a scan. It was a question. One question nobody thought to ask. And it took a nurse off the clock at our kitchen table to ask it. The next time someone hands you a plate of sushi, remember the boring tooth, the acid-proof shell, the invisibility cloak, the proteins that survive cooking, and the 40-day wait for a camera that could have ended the pain in 30 minutes. This is Diagnosis Glitch. I'll see you in the next waiting room.